What is medicine for? What has God given us to know about the nature of our bodies? What can we learn from others within our own religious traditions and communities? And what can we learn from folks who are from different traditions and communities? And what place does modern medicine have in those practices? These are questions that can't be fully settled. They have to be embraced and engaged again and again.
One of the things I really wanted to bring to this conference was just an emphasis on relationships and on meeting people, and the opportunity as an attendee to not only listen but to engage.
One of the first things we wanted to do was to try to create a forum where people who have this interest could come together in ways that other kinds of medical conferences really wouldn't allow.
We had a grant from the Templeton Foundation to put on a conference regarding the intersection of religion and medicine. And we started that conference downtown Chicago in 2012, and it's been slowly and steadily growing ever since.
One of the things that makes the conference very unique is that it's a truly interdisciplinary conference in which people are coming from a very diverse set of disciplines and practices. And they're coming to this one place and they're engaging one another. And that makes it very unique. So we have, on the one hand, physicians and social scientists to theologians and religious studies people. And these are people that aren't normally meeting in the same place and interacting with one another.
We also have the bioart exhibit here. So we talk about that and what was the impact on seeing these photographs and pictures. And also, what about seeing the individuals who prepared these posters and did work for maybe 6 months to develop them? It really helps broaden us and helps us establish what we're going to do in the next generation.
There's been a growing interest in spirituality and healthcare on the part of patients for quite some time, and people have documented it. What's also happening now that we're latching onto is the growing interest among clinicians, among physicians, nurses, in addressing the spiritual needs of patients and also attending to their own spiritual needs as healthcare professionals.
Over the years, it's been very satisfying to meet the amazing people that we meet at this conference. Colleagues from a lot of different disciplines, a lot of different spaces within American medicine come together because they share an interest in those really central human questions. Who are we, and how do we make use of medicine in a way that's fitting for the kinds of creatures we are?